operations to clean out the arteries, the carotid arteries, work very well to reduce the risk of stroke in patients who have had warning symptoms, transient ischemic attacks or TIAs. But the benefit of surgery or stenting is much, much less for people who have narrowing of the carotid arteries but no symptoms. So that's called asymptomatic carotid stenosis. And we started in 2005 trying to find ways to identify which patients with asymptomatic stenosis have a high enough risk of stroke or death that they could benefit from stenting or this operation called an endarterectomy. And so in 2005 we showed that if you just put a little helmet on the head and listen for an hour for chunks breaking off the artery, that clearly identified the patients who have a high enough risk that they might benefit from surgery. And it showed that 90% of patients with asymptomatic carotid stenosis were better off with medical therapy. Since then, with more intensive medical therapy, we've reported that only 5% of patients now, or less, have microemboli, so only 5% would benefit from surgery. But this study that's being published now adds another way of identifying high-risk people with asymptomatic carotid stenosis, and that's a 3D ultrasound examination of the carotid arteries, looking for ulcers, ulceration of the carotid plaques, or areas where some of the plaque has broken off and gone up into the brain. And in this study we found that patients that had 3 or more ulcers in the carotid arteries on either side had a risk that was equivalent to that of patients with microemboli. Our microemboli results were confirmed last year in a multi-center international study, but this is the first study to show that ulceration detected by 3D ultrasound identifies high-risk asymptomatic stenosis. Yeah, so these are three-dimensional images of the carotid arteries. This slice here is in a cross-sectional view. This is a longitudinal view of the artery. And these arrows are pointing to places where some of the plaque has broken off and gone up into the brain. So that's a big ulcer in this cross-sectional view. Here's a smaller ulcer here. Here's another big ulcer in this cross-sectional view, a smaller ulcer there. So these are all little ulcers, which are defects in the surface of the carotid plaques that mean that that plaque has been unstable.